Congress Member Kathy Castor, I'd like to thank you for joining us on WMNF.
Thanks, Sean. Thanks for having me on.
And what can you say about the latest news that we're hearing that the state of Florida fired the person who was in charge of the data for COVID-19? What's the importance of something like that happening?
Yeah, excuse me, this revelation is outrageous and it's dangerous because if we're going to contain COVID-19, we need all data and information on where infections are happening, what kind of tests are being administered, who's in the hospital, and unfortunately who is dying and where they're dying. And Florida had built a nationally renowned dashboard that had all of the relevant data that was available for scientists and public health experts and the public. And it's just astounding that the state of Florida would move to fire the data scientist because she spoke out and said, we need to be transparent. We need to be posting all relevant data. When they tried to remove some of the data, she raised concerns and then they fired her.
The governor's office says that she was fired because she was insubordinate and she didn't get authorization for not removing these data. Do you find that an explanation sufficient?
I do not. And the Governor DeSantis yesterday also said something that I thought was beneath our governor. He said, well, she just needs a break. Maybe she's tired and needs a break. And I thought that was rather condescending. And we really need to be working together and ensuring all of the data is available. And what's happened here, now we have an unfortunate pattern at the highest levels of the state of Florida, the Department of Health and the governor's office, that we really need accurate information during a pandemic. But here's the pattern. They had originally kept hidden a lot of the nursing home data on infections and death rates. And thanks to public outcry, they finally did better and released data on that. It's been hard to get information about infections in our prison system. The state of Florida also started to redact and remove information reported by our medical examiners across the state. The medical examiner reports are public records, and the governor's office sought to hide a lot of those records. And now, on the heels of all that, this courageous data scientist said, no, I'm not going to take down some of the important data. That's the wrong call, she said. And instead of listen to her, they have demoted her, and now it appears they fired her for that reason.
So all of this begs the question, do you think that Florida is making its reopening decisions based on science and public health data or based on politics?
Because see, this really complicates the matter. It appears that, especially here in the Tampa Bay area, we've done very well, and I think that's due to consistent messaging. Our local leaders came out decisively early on, encouraging folks to stay home, and many people understood this. And thanks to the citizens around here, they understand what's at stake. But if we don't have the correct data on infections and testing, hospitalizations, disparities, and deaths, people are not going to be comfortable going back to work, going back to school one day, or going out in the public.
If you look at the dashboard that this whistleblower created, lately over the last 3, 4, 5 weeks, it looks like there's some variation, but pretty much the steady level of number of new infections. The number really isn't declining that much. Do you think that Florida is reopening too quickly?
It appears from the CDC guidelines, where they advise that you want to have a decline in infection rates, you want to have a decline in cases and mortality, that we're not quite there yet. But that's why the public health reporting is so important in this day and age. People will make those determinations about how frequently to go out, whether to go back to work based on the facts. And it's so unwise to hide this data from the public at this time, it's going to make it more difficult. People are not going to have the confidence to go back to work and go shopping and go out. So it's completely unfortunate. It's just not smart.
Before I move on to a couple of questions about the state's unemployment system, I do want to ask you one last question about the state employee who was fired. Do you think that there should be an investigation into her firing?
I absolutely do. I do. And, Sean, it reminds me just last week in Washington, we had a congressional hearing with Dr. Rick Bright, who was the director of the Biomedical Advanced Research Development Authority. And he said kind of the same things, that he had spoken out about the need for masks early on. He raised the concern about the growing pandemic. He said we don't have the evidence to support widespread use of hydrochloroquine. And for all of those reasons, his superiors retaliated against him. And this is very similar. I think this data scientist who built one of the best dashboards in the country obviously had all of the modern tools that we need to get the information out. And she raised concerns with her superiors, didn't agree, and they retaliated against her. So I see a lot of parallels here. And like I said, the public is not going to have the confidence to return to work or to school or go out in the public unless we understand what's really happening.
So let me transition to another huge issue statewide in Florida, and that's unemployment and the state's difficult reemployment compensation system. Several people have called WMNF to say that they're unemployed. The state has shaved off part of the $600 federal unemployment payment. Are you hearing similar cases, and does the state have the right to do that, or did Congress intend for every unemployed person to receive the full $600 from the federal government?
Yes. Wow. I'm very concerned to hear that. The $600 per week for the 4 months was intended to be paid in full. We understand that this has been a debacle at the state level. This is an unemployment system that was designed to fail by former Governor Rick Scott and the members of the legislature. Governor DeSantis should have been top on his list when he took the oath of office and came in to fix it. But because he didn't, he's stuck with trying to fix it now. But he has not demonstrated leadership here. He really should be focused entirely on fixing the system, making sure that people get the emergency aid that they need. That's why you have an unemployment system. That's why employers pay into it in cases of emergency. And the impact this will have to everyone cannot be underestimated. Even if you are fortunate enough to still be working, and our state now, because we're the stingiest in the country on the benefits we provide and on the time frame for the state piece, which is limited to 12 weeks, unlike every other state, we're going to have fewer dollars circulating in our economy. That means that there'll be fewer dollars going into our small businesses to help our small business owners and their employees. We won't have as much in people's pockets for them to go out and spend on their local restaurants or takeout or buying the essentials. So this is a real economic hit, a sucker punch to everyone in Florida because they can't get it up and running and they're so stingy.
And the federal $600 part, it sounds like you're saying that everyone should be getting the full amount. And if they're not, what should they do?
They should please let my office know. I'd like to know how often this is happening and then we'll get to the bottom of this, of why that's happening. This is the first I've heard that the state is shaving off the $600 per week benefit. I know there are many problems with the state benefit that's capped at $275 per week.
And my last question has to do with the bill that you just passed last Friday in the U.S. House. What are the chances of that getting through the Senate and getting signed by the president? The Senate leaders and the president have both said that bill is going nowhere. So how will the House make common ground with Trump and the Senate on this bill?
Yeah, don't believe that when they say it's going nowhere. everyone understands that this is an emergency situation, just an unprecedented time in our nation's history. Already the economists and other experts are advising the Congress to act boldly, be ambitious on this. And that's what we did last week. The House of Representatives listened to folks back home all across the country. And they said the first priority will be to keep our first responders on the job. That's why we called the bill the HEROES Act, because we do not want police, firefighters, first responders, public health workers or teachers to be laid off. And that's what will happen as revenue falls in state budgets and city and county budgets. Just yesterday, I had a bipartisan call with mayors across the Tampa Bay region, and they highlighted for me their serious budget woes that they're looking at. For example, here in the city of Tampa, major decline in our convention center, pressure on the budget for the city of Tampa. The mayor of Lakeland highlighted, they have a close relationship with the hospital. They run their own utility. They think there are going to be serious consequences. Mayor Kreisman over in St. Pete said tourism is way down in a town that relies on those dollars. They're very concerned about workforce, how they're going to have to pay to retrain a lot of folks. So the HEROES Act will help. And I think the United States Senate, while they say, oh, we have time to pause, we don't have time to wait. It's time to get to the negotiating table, make sure that we're focused on our frontline heroes, make sure we're focused on the robust, frequent and rapid testing regime that has to happen with help from the federal government, and support for folks who are really struggling with more direct cash assistance and probably more unemployment assistance, and help for student loan borrowers who are on the hook, and some help for rent on the basics, rent and utilities.
Is there anything else you'd like to share with our listeners?
Yeah, that HEROES Act package is massive. It's a $3 trillion bill, so it's difficult to encapsulate it even in the time we have together. But I encourage everyone to look through it and just trust that we've got your back. We don't want the emergency aid to go to big tax breaks or big corporations. There's enough of that. We want emergency funds to go to the pocketbooks of people who really need it, who are struggling, who are doing what's right in a public health crisis, staying home. And oftentimes that means that they've been laid off or furloughed, and we don't want people's lives to spiral downward. We know that we'll get through this. We've invested a lot in cures and vaccines, and those will come with time. But in the interim, we want to make sure that people stay healthy and well and get the help they need.
Congress Member Kathy Castor, thank you so much for joining me on WMNF today.
Thanks, Sean. I appreciate it very much.
Thanks. Take care. Bye-bye.
Okay. Have a good one.